Welcome to another beautiful episode on this segment on Daybreak Africa. I am Angela Daku, and today we'll be talking about a ravaging illness hovering in the society, which is Lassa Fever. To discuss this with me today is a consultant clinical virologist and a professor of microbial pathology from the University of Medical Sciences, Ondo, in person of Professor Michael Simidele Odimayo. Pardon me. You're welcome to the program, sir.
Thank you very much. Viewers, you are welcome to this session.
Thank you so much, sir. Well, moving on to the business of the day, sir. Many people know about the existence of Lassa fever, although they do not understand the content of its gravity. So I would like for you to explain in details what it is all about.
Well, Lassa fever is a viral systemic illness that is contagious and that is deadly, that is occurring in our environment. We have it in Nigeria, in Ghana, Sierra Leone, Liberia, and some other parts of West Africa. It's a very, very severe and serious disease of viral etiology caused by viruses and usually transmitted by rats, multi-mammate rats that we have all around here. So it's a very serious disease, and usually between December and March, the incidence increases. So this is actually a time that we really need to get our people to be reminded that the deadly disease is around and everybody needs to take the necessary precaution to avoid those problems.
But why does it occur in this period of time?
Well, the reason why it occurs, this is dry season, and the virus is usually transmitted through the feces or urine of infected rats. And usually, because the infected rats, those waste material, the urine or the feces, they can easily be aerosolized. They can easily be turned and vaporized and get in contact with people. And these days, you have the animals being moving around at homes, around, and some of all those people catching them, and then people can easily get infected from the rats itself.
We were meant to understand that it's actually contracted through body fluids. So what other ways can it actually be contracted?
Yes, the primary transmission is from animal to man, and then usually from the fecal material of animals or whatever, and even through contact with them and some other things. But when it is among men, from humans to humans, usually from body fluids of humans, maybe sweat, some contact. But ordinary skin contact may not be a major problem, but through the sweat, saliva, and then through body fluids, maybe like blood or serum from that individual, or semen, or some of all those other things, or even through the tissues of an individual that is infected. Even through what an individual that is infected makes contact with, which we call fomites around, another person can get contacted, can get it through such items that the person that is infected has touched.
Wow.
Yes.
What level can it attain that it will be referred to as manageable? And how fast does it spread?
Well, the disease can easily spread between humans, especially in the hospital or in household of individual that is infected, or around the people that is close to such an individual. But the primary source here is from rat. So people who go about hunting for rat, eating rat, or when rat infects the house and they eat some of the food material that is being eaten by humans, and the human now go ahead to eat the remaining part. If the rat that has eaten some of all those things in the house, if they are infected with Lassa fever, then they can drop the viruses on food material. And if such food material is not properly cooked, then that person can get it transmitted. Even for an infected rat or any of all those rodents, if they are cooked and they are not properly cooked, an individual that eats it can get infected if such a rat is infected with Lassa fever.
In the case whereby somebody already contracted the fever, is there a certain stage it gets to that one could say there is no cure for it, or how is it being done?
Well, when the fever starts, usually it starts with fever, weakness, and whatever. At that level, at the earliest stage, if the person is treated, if it is able to be picked and treated, the person can easily get recovered. Because what was known is that at the earliest stage, in all the infection, 1 in 100, that is 1%, can die. But when the disease becomes severe, that it will require hospitalization, up to 15% of the people that are involved dies. But we know that within the hospital setting, people that get infected within the hospital setting, up to 65% of the people die as a result of those infections. So the more severe the disease becomes, the more likely that the person may die as a result of that disease.
Although, is there a permanent cure to it?
Yes, there is permanent cure, provided it is met early enough. Usually we have the standard treatment. The person gets to the hospital, investigations are done. Because the drug that is used also, you don't just want to give it to an individual unless you are very sure. So the diagnosis will be properly made and the person will be placed. But usually in these cases that are being treated is intravenous drugs that are given to such an individual, that is given to that individual for that person, and it has to be intensive care, usually in a very special ward, so that you don't also allow the infection to be transmitted. So once an individual is diagnosed to have Lassa fever, there's a special facility that will have to put on that person, put that person on. Serious treatment has to be given with serious protection for the people also that are caring for such, because an individual that is also treating that person can contact the virus and die. We have had so many cases of people dying as a result of the disease, even as doctors or as nurses. In short, the first time it was identified in Nigeria in 1969, 3 nurses died. They were managing a pregnant woman that have Lassa fever from that. So you can see that usually there is cure. But the cure is a properly and a carefully organized management. All the symptoms, all the complications that may be associated with it are usually properly taken care of. So it's definitely an intensive treatment that is needed for an individual that is diagnosed as such.
Well, in as much as people know that all these rodents are around the environment where human beings are, so many of them still tend to be ignorant about their environment, thereby making them prone to the disease. So what could be done to stop or reduce the situation? Or what can they do to help eradicate the rodents away from the environment?
Well, the major thing here is that our people should be informed that rodents, rats, more especially this multi-mammoth rat, they are agents that can transmit the virus from the animal level to humans. So people need to understand that, and then you keep your distance from them by making sure that your environment is clean. You don't allow dirty material that will attract those rats and whatever. Then it's better that we keep our household safe from rodent infestation. If rodents are coming into the house, then they can easily feed, urinate, pass their fecal material on it, and the household can become endangered, because the fecal material of infected rat, the urine, when they vaporize, an individual can get infected through that. So as much as possible, you want to keep your house clean. You want to protect your house from being entered into by all those rats, and you want to keep your environment clean so that they don't get closer. I want to tell people to do less of hunting for rat. But in case you want to even eat rat, you want to process it, it's better you wear proper glove, and then if you want to eat it, you cook it properly. Otherwise, the person can eat the virus and get down with the disease.
Well, you already explained what the disease is all about, but I would like you to explain further about the complications of it.
Well, the complications of the disease, one of the commonest complications is hearing loss. The individual can go into deafness as a result of that, and though sometimes we get, then individual that is pregnant, they are at very serious risk. If you are pregnant and the person is infected with Lassa fever virus, the person can come down with severe disease, and the thing can be deadly. It can also result in intrauterine fetal death, that is death of the baby, or stillbirth for the babies. And then it can lead to kidney damage, because usually the way those things come up in the pathogenesis of the disease, you see a lot of fluid losses from the blood vessels, and that one can lead to kidney shutdown and lead to acute kidney disease that can damage the kidney and so many other organs in the body. So it is really serious that person needs to really be careful with it, because it can lead to long-standing complications.
You mentioned about pregnant women and their babies. What if the baby actually survives? Is there a possibility that the illness can be contacted by the baby from the mother?
Usually, for the viruses, it's been observed that the death that can result is as a result of the virus impact, because there are a lot of fluid losses from the blood vessels. So the baby could die because of the infection of the mother. So that means the baby can be affected by and there could even be stillbirth as a result of that. Well, especially for pregnant women, towards 10.
Well, from your own perspective, sir, do you think the government has played a huge role, especially in helping to eradicate this disease, especially in the area of medical centers?
Yeah, the government has really tried, and also we have a lot of public information to prevent it. There are centers where you can easily be managed in the state. We have the infectious disease hospitals. We have one in Ondo here. We have one in Akure. We have in Owo, where you can easily manage those infectious diseases, because these are serious infectious diseases. Just like we have COVID that time. Those centers that were used for COVID can also be used to manage this. We have in Owo also. Then the diagnostic equipment has been provided. We have in Owo. There was a time our department, microbial biology department, requested for upgrade of our lab, and the state government promptly responded and gave us some equipment that we could easily be able to use to diagnose those viral illnesses. So, and we even have molecular lab in Akure. So all this, the effort is on that the government is trying to make, and I think if we're able to sustain the health system will be able to make sure that we can take care of it, and people will be able to be preserved when they get infected. But prevention is better than cure. Yeah.
Well, on the part of the citizens of the country, are they actually collaborating enough in the fight against Lassa fever?
Well, we may not be able to say. We have told people about need to keep the environment clean. You may be able to observe, are people doing that enough? We have talked about use of regular hand washing, which is also very important, and some of all these other things to keep personal hygiene, and to play less with rats, and to be sure that the environment is free from various rat infestation. I think people are doing that, but people need to also rise up more, so that we can be able to protect ourselves, our families, and our community. So I think the response is fair, but this health education should awaken the interest of people to be able to be more responsible for the health of the environment.
So what would be your words of caution to Nigerians out there, to the general public?
Well, in times like this, we should realize that this is about the peak time for transmission of Lassa fever. And Lassa fever is deadly. Many people can die as a result of it. So everybody, every one of us, we must be prepared, and we must make every effort that is needed to keep our environment clean, keep it free from infestation of rats and others, and be sure we keep our personal hygiene too. Regular hand washing is very important. And also, I want to tell our colleagues in the hospital too, as we care for the patient, we should have a high index of suspicion, so that patients that may have Lassa fever, we can easily sort them out and refer them to appropriate location for proper management. And when we even make the diagnosis, we should be able to carry out and utilize the appropriate personal protection equipment so that we don't fall down because of Lassa fever.
Thank you so much for being a part of this discourse today, sir. It's been a pleasure having you on the program.
You're welcome. Thank you very much.
This is where we'll draw the curtain for today on this discourse. Till we meet again, I am Angela Daku.